Hi, I am Ruth. We will learn about insulin titration today. But before that, meet Emma. Emma is the ward cover FY2 this weekend. Emma had a call from the ward sister to review a patient with high blood glucose levels. Emma saw the blood glucose chart. Ward sister was worried about the blood glucose of 20. Patient was not due for his regular insulin for some time, but he was well and had no symptoms. Emma prescribed a stat dose of Actrapid 6 units. An hour later, Emma had a call. Blood glucose was again 20. Emma advised a second dose of Actrapid 6 units. After 4 hours, patient had a hypo. So, Emma, what went wrong? Shall we learn about insulin titration today? Before you titrate, you should know the blood glucose target for the patient. Aim for blood glucose levels between 6 and 10 for inpatients. 4. A well patient with high blood glucose levels, try to titrate his insulin rather than giving a stat dose. Look at the trend of glucose readings over the past 2 to 3 days rather than a single reading. View the glucose readings in relation to the type of insulin and timing of insulin. This patient is on Humulin M3, twice a day. Emma, can you tell me which insulin was acting when the readings were high? Yes, that is correct. It is the morning dose of insulin. Now, increase the morning dose of insulin by 10%. From 30 units to 33 units. Review in 48 hours. Consider further titration if needed. Refer to specialist team if the levels remain high. Look for the causes which can raise levels temporarily. Hence, review the dose regularly. Emma, are you wondering when to give stat dose of insulin? Consider stat dose of insulin in a type 2 diabetes patient if symptomatic or unwell. Certainly consider it in a type 1 diabetes patient if unwell, and in those undergoing surgery to achieve target blood sugars. So Emma, how much stat dose do you give? Remember, in patients with type 1 diabetes, 1 unit of insulin will drop up to 3 millimoles of glucose. In type 2 diabetes, you may need to give a bigger dose. Emma, what is the choice of insulin for a stat dose? Choose rapid-acting analog like Novorapid over Actrapid for prompt correction of hyperglycemia. So Emma, shall we look at what we learned today?